This morning, I'm joined by Sue Parris from York Podiatry Limited. Sue is an avid MLS laser user. So this morning, I'm going to be talking to her a bit more about how she uses the laser in her clinical practice. She's going to be sharing some cases with us and some general information on why she likes using the MLS. So could you just tell us a little bit more about yourself to start off with?
Okay, well, as you've already said, I am Sue Parris. I work for York Podiatry Limited. I've been here now about 18 months, having moved up from Northamptonshire, where I worked in the NHS for 35 years. Part of my role within the NHS, I was a placement educator, a staff mentor and tutor, if you like. And I've worked primarily for the latter part of my career in diabetes and high-risk limb. I've always had keen interest in MSK, and so the chance to move into private practice and revisit that, and then to jump in with the laser as part of rehabilitation has been brilliant.
Fantastic. So can you tell us a little bit more about conditions that you're commonly seeing in the clinics that you're treating with the MLS laser?
Yeah, sure. I mean, we get mostly, I would say, plantar fasciitis and Achilles tendinopathies. That's been the bulk of what I've seen, really. A lot of plantar fasciitis comes in to see us, and quite often quite chronic because people typically don't know what to do about it until they Google it and then they realise they need some help. We've had a few arthritic conditions. So we've done some knee arthritis as a form of pain relief, whilst patients have been waiting to go either for further treatment or just as an adjunct to what they're already doing and improving mobility. So we've done a couple of those, and also a hand arthritis, which has been one of the cases I'd like to share, which has been particularly rewarding.
Fantastic. And on the whole, for these different conditions, are you seeing good results for your patients?
Yeah, pretty much. Some of them take longer than others. And I think that's part of the learning process that we all go through with the laser, because it is a learning process. And I think it also represents the fact that everyone's individual and unique, and you have to start with something and build on the treatment. It's part of a process. There are a lot of things that can vary between patients, their compliance being one of them, I suppose, the longevity of the condition, and the type of even work and occupations that people have, because for some people rehab is difficult just because they're on their feet a lot, and you have to work with that and go with it. So on the whole, yes, a good improvement, some taking longer than others.
Yeah, that's perfect. I think that's pretty much what we expect in clinic, isn't it? We always say
Yeah,
everybody is an individual, everybody's the sum of one, and they all will respond in their own ways. But as long as we're
yeah,
seeing a general improvement, that's what we're after.
yeah.
So you mentioned a hand arthritis there, Sue. I know you've got a case or a couple of cases that you want to share today. So I would love to hear a little bit more about them.
Yeah, so we had a gentleman who came in literally requesting laser treatment. That was his primary objective, because his partner had been in with the plantar fasciitis, which had responded very well to the laser and insole therapy, along with other stretches and things like that. But the laser primarily had given the patient a big leap forward from where she'd been in terms of pain relief. So he'd gone home and thought, oh, I wonder if this will work on my hands, read the information and rang up and said, I want to book an appointment for some laser. So we saw him for an assessment and agreed that would be an appropriate thing to try, fully understanding of the fact that, he may or may not get the massive improvement. We tried to manage his expectations, but it was actually very, very successful. He came in for a course of 6 treatments over 6 one-week intervals, had a significant improvement in his pain levels, and subsequently has improved in function and strength because he can do more. So he's using his arms and hands more, within sensible parameters, and his strength and ability to do daily tasks has improved. So the settings that I used were straight out of the machine. I always like to start just straight out of the machine. We've got a hand arthritis setting, so we use the scan phase straight from that. We use the arthritis setting, which I think is a 15-point setting, 500 hertz, something like that. I've got it written down somewhere, but I forget now without looking at the guide. So we used that setting, and the first time I saw him, there was some trigger points in his arm, further up the forearm, which we treated. But after that first treatment, they'd completely gone. So the interesting results, after the first treatment, he came in and reported about a 10% improvement in pain, which I thought was quite good for someone with a really chronic condition. And on his first appointment, we actually did a little picture, which I totally pinched from the group, the Facebook group. So,
this is a Patrick Kane's.
It may well have been. I'm just going to fold the
Yeah.
top of the page down because I might have just included the patient name on there. So we've got a little picture here. I don't know if the screen can
Yeah,
pick
we
that
can
up.
see that. Yeah.
There's little arrows pointing to before and after,
Yeah.
and
Yeah.
pre and post treatment, and the same on the other hand.
That thumb
So-
difference is huge. The space
Yeah,
that he's getting between his thumb and
exactly.
his forefinger. Yeah.
One of his hands increased quite a lot, and when we did the drawings to the treatment, immediately after the treatment, he was quite, oh, you know, it's good, I can do a bit more now. Just loosening everything up and a little bit of pain relief. So he said the 10%, came back for his second appointment, said probably about 10% improvement. I think at that point, I'm going to have to refer to my clinic notes. At that point, I think I increased the treatment setting from 50% to 75% because it just slightly increases the joules per centimetre squared, I think, doesn't it? Just brings it up to a slightly more therapeutic level. He was reminded of rebound pain, and off he went. Now, when he came back for his third appointment, he said, in fact, he had some rebound pain.
Yeah.
He'd had a couple of days of it feeling a little bit sore. But on the third day, which was the Sunday, his hands felt amazing, he said. And he actually hadn't realised how good they were until he got to the top of the stairs carrying 2 mugs of tea on the Sunday morning, one for him, one for his wife, and suddenly realised he hadn't been able to do that for years. He'd always had to do like a two-handed grip.
Okay,
And
fantastic.
he came in and reported that, and he said, I just stood there for a minute and thought, oh my God, I've done. And this is how his progression has gone on. It was just before Christmas. And we carried on with the treatments. I think up to his last treatment, I'd actually increased both the settings up to 100% of intensity on the 6th one, the scan and the treatment phase, because he was responding well at that point. And when he came in after Christmas, he'd opened a new jar of marmalade for the first time in 10 or 15 years. And all these little things have actually said to me, it's life-changing. He said it's made such a difference. So I was really delighted. We've got him on a program of top-ups now. Initially, I advised him to come in for some 2-week apart, 3 at 2 weeks and then 3 at 4 weeks to see how he went on. But there was a bit of family stuff going on, and we didn't see him for 6 weeks. So he's taken a couple of steps backwards, but we're just going back down the road of recovery again now. But he's still really, really pleased, and so much better than he was when he first came to see us. So for me, that's been a real big win. I've just loved it. And he's such a lovely chap. You know, you have these lovely conversations with your laser patients, don't you? You get to know their life and their history and their background, and it's a really relaxing treatment to do. So hands has been odd because you're kind of a bit more up close and personal with people. And it is a little bit odd holding someone's hand like that, you know, but it's been a really rewarding process to go through.
Yeah, I always think that's why we as podiatrists or any healthcare worker, that's why we do what we do, because we want to make people feel better. And when you do that, especially with a tricky condition like arthritis, that is, like you say, a total win. And just to point out, because I know this was something that you were a bit like, oh, should I share a case of me treating a hand when it was, you know, when I'm a podiatrist? So just to point out to people as well that if you're a podiatrist, certainly if you have your insurance through the Royal College of Podiatry, you are insured to treat from the hips down and also hands. So you are within your remit to treat hands with the laser as well. So all good.
We did check that before. When he inquired, we did check to do that. And he has a known diagnosis We're not making a diagnosis about his hands. His diagnosis is known and confirmed. He's had management for that over many years. So we weren't sort of edging our bets at all in that sense. It was a very clear-cut case of pain relief. I think, the main thing for me about treating it from the outset, the thing I was a little bit concerned about was just managing expectations with the patient, because it was a long-standing and chronic condition. So we did have chats about that, and also making sure that he clearly understood we weren't curing his arthritis. Pain relief and ability to function better, which hopefully would lead to some strengthening. So he does some strengthening exercises now with little resistance balls, which he can do now, but more because he's got less pain in his hands. And I would just say with treating it, one of the interesting things, and I did have to go back to my anatomy books for this, is finding the optical windows in a wrist. And when you've got a limited range of motion, just finding all the little gaps. One thing I found with the laser head, because it's got that lovely curved surface, is that actually when you flex a wrist, if you just nuzzle the laser head onto it, it sits into the little hollows, and then you can sort of find your little opening, put your wrist into whatever flexion you want, and then deliver your dose when you've got 15 points to work through. So it's just a case of getting the patient to do a bit of movement. Just when the head sits, you kind of know you're in the window that you need. So that was a really interesting thing to work through as well. And wrist and thumb, I mean, it's mainly this and the base of the thumb that are the main areas for the pain that he was having. So that's the bit we were treating.
Top tips from Sue. Optical windows with Sue Parris. Brilliant. Okay, so based on your experience with the MLS, how much you enjoy using it, or the results that you've got from your patients, would you recommend MLS laser to other practitioners, other clinicians?
Yeah, absolutely. If you're getting any level of MSK work in, if you get your plantar fasciitis, or your inquiries about how to manage pain and arthritis in the foot, anything like that, yes, absolutely. It's been so useful as part of our armory, if you like, of tools that we can use to improve pain. I can remember back in the day when all I had was, go away and do some calf stretches, do some Di Giovanni's, use your Voltarol, put an insole in, that was fine, but people were still limping around for quite a long time. To be able to see them on an initial assessment, and when you've got that confidence of your diagnosis, and say to them, look, you've no contraindications to the laser, we could pop the laser on it today. It may not on a one-off dose give you much improvement, but it might just help with your pain. And a lot of the time it does take the edge off the pain. They come off the bed and they'll say, everything from, oh my God, I'm cured, which I did have one lady who did that, to, well, actually it's still a bit bruised, but it's better than it was when I came in, and then I think they've got that confidence of your treatment working. They're not just thinking, oh, it's just up to me, you've done something positive for them, which I think is really, it's a really big thing when you've had a painful foot for a long time.
Yeah, definitely. So the $1 million question, Sue, can you choose 3 words to describe MLS laser?
Well, I had to think about this a little bit, but what I came up with was actually, and this is because these are words that patients have used to me when I've treated them: miraculous, life-changing, and successful. Do you see what I did there?
Yeah, I like this. Perfect. That's brilliant, Sue. Thank you so much for sharing your experience and your patients' experiences and your time this morning. I really appreciate it.
It's been a pleasure. Thank you very much.